Starting.
Boa tarde a todos. Espero que me estejam a ouvir em boas condições. Eu estou a começar em português porque até ao momento só vejo nomes de pessoas que, enfim, em princípio falam português, mas o webinar terá lugar em inglês. So now moving to English. So welcome to this webinar. This is a webinar in a series of webinars that the School of Medicine at the University of Minho is actually stimulating, and the topics are quite different. Today, the topic for this webinar will actually tackle the issue of assessment and the foundations of assessment. We have two amazing speakers, Dr. Brownell Anderson and Dr. John Norcini. They will tell you more about this issue of foundations of assessment in a couple of minutes. I'm just making sure that, because we had several dozens of people saying that they would attend the webinar, I'm giving some extra minutes so that we have more people joining us in this webinar. I promise that we will keep the schedule and we will end the webinar in due time. But I think it's always good to wait a couple of minutes, because especially for those attending from Brazil, this is still working hours. So if you would agree, we will wait till another 3 minutes more to have more people online, okay? In the meantime, maybe it's interesting for me to tell you that that the School of Medicine at the University of Minho is actually stimulating some post-graduation activities on these topics, namely a master that is specifically focused on assessment for health professionals. And we are currently undergoing the first edition, and the next edition will start in February 2023. Those of you who want to know more about it, Beatriz Araújo will actually later put on the chat and the link to the information that you can obtain regarding maps. This is a program that is running in Portuguese, Spanish, and English, so it's very convenient for all of us that speak Portuguese and Spanish. Okay, so I will start with the introductions. So Brownell Anderson is one of the most well-known researchers and scholars on the topic of assessment, and Brownell has been working in several institutions, but always with this focus on how to establish bridges between the academic world and the healthcare world. The same applies to John Norcini, obviously a leader in the field for many years, with a special, fantastic and special research work on tools for assessment in workplace environments. So it is my pleasure to give the floor to these two friends, but to these two fantastic speakers that will introduce the topic today. And later on, we will open for discussion after Brownie and John presented some slides that then will stimulate our discussions. So thank you, Brownie. Thank you, John. The floor is yours.
John, you're muted.
So John, you are sharing your screen, but you are still muted. And you are still muted, John. He knows, he knows.
Is that better?
Yeah, now it's
okay. I think in a sign of eminent good taste, Beatrice decided that I could not unmute myself. I think yes, you. I think my children would love to have a similar button. Okay, so what we'll do over the next few minutes, Brownie, Nuno, and I have talked. Obviously, in the kind of time we have today, we can't go through all of the foundations of assessment. But we thought what we would do is sort of very quickly talk about two things. First is speak very briefly about assessment and the roles it takes, what some of the purposes for assessment are, and what one or two of the important lessons around assessment are. And then we'll talk about the framework for assessment that has been created through the Ottawa Conference. Many of you may be familiar with the conference. It occurs every 2 years. And one of the best and perhaps most unique parts of the conference is that they've decided to develop a series of white papers which express the consensus of the community around important issues. So in 2010, one of the groups met for the first time and developed a consensus statement about a framework for individual assessment. 2018, that group got back together again to talk about systems of assessment, and we'll describe what they came up with. So that's the plan for the next few minutes. And so let's start. What roles does assessment play? Well, I think the one that everybody is familiar with and the one that comes first to mind is that the purpose of assessment is to ensure competence. And that's certainly the case. That's certainly the history of assessment. But in recent years, in the past 10, 15 years, folks have begun to talk about a second role for assessment, and that's to support and create learning, to provide feedback in a way that helps students learn. So the two primary roles of assessment are first to ensure competence, second to support and create learning. But there are a series of side effects of assessment that are really critical and that you can manipulate when you think about doing assessments. And the first and probably the most important of those is that assessment communicates what you value. So what's on the test is what's important, and in the eyes of students and others, if it's not on the test, the assumption is that it's not important. So that in thinking about assessment, it's important to think about what it is exactly you want to do with it. And keep in mind that it's not only what you put on the test that's important, but it's what you leave off that's important as well, because students won't be motivated to study it. There are thousands of different assessments there around. There are assessments of attitudes, there are assessments of knowledge, skills, and performance. Whole variety are available. And the purposes are critical. And I think when creating an assessment, the first and most important thing you need to do is think about what the purpose is. So some common purposes are feedback, formative assessment I just mentioned, decision-making, summative assessment, Assessment has an important purpose in creating grades or ranking students for admissions, for example, or benchmarking against other institutions. Assessment serves as motivation for students. I know some faculty members who conduct assessments simply to motivate students to learn. From the perspective of patients and the public, it acts as quality control. It ensures that students ultimately have the kinds of skills they need in order to care for patients appropriately. And finally, assessment is used for evaluating teaching and the curriculum as well. So there are many lessons we've learned about assessment. I'll mention just three because I think these are among the most important. The first is that changing assessment has a greater effect than changing the curriculum. So what you assess, students learn. And if you change what you assess, you'll change the way they learn much more so than simply changing the curriculum. Second thing is that assessment methods influence how students choose to study. So for example, if you give students a knowledge test, they go to books to learn. If you give students a standardized patient exam or an OSCE, if they're to study for that, they go to the clinical skills lab, or they might go to the bedside. Assessment also influences faculty and how faculty behave, certainly around the purposes and around how they teach. So these are three really important lessons that the three of us have agreed are among the most important in terms of assessment. So let's talk very briefly about, I'll talk very briefly about the assessment consensus groups. This is the group in 2010. In 2010, as a group, we decided we would get the band back together again to look at things in 2018. So the group changed a little bit, but we were fortunate to have a big core of folks come back. Note in particular that Valdez from Brazil and Manuel from Portugal were important parts of this team and contributed considerably to this. So then in 2010, the group focused on individual assessments, and they decided to identify the elements of a framework for individual assessment. We came up with 7 things. We came up with validity or coherence, reproducibility or consistency, equivalence, feasibility, educational effect, catalytic effect, and acceptability. And I'll talk about each of these for just a minute. As I talk about this, I want to be clear that these aren't something that we created out of whole cloth. In fact, one of the things we did is we went through the literature as part of this, and we took as many ideas from other folks as we can. So this is not being presented as an individual and or creative work, more a summary of what was already available. And to that, we added our own thoughts. So the first and probably the most important of the elements of the framework is validity or coherence. There's a body of evidence, and that evidence supports the use of an assessment for a particular purpose. So a test is neither valid nor invalid. Instead, there's a body of evidence that speaks to whether or not it's appropriate for a particular purpose. First element. Second element is reproducibility or consistency. So obviously, if you produce an assessment of a particular kind and you gave it to the same students a month later and they didn't learn anything in the meantime, you'd want them to get the same scores. So that's what reproducibility or consistency speaks to, a sort of consistency or reproducibility over time. Third element is equivalence. Different versions of assessment yield equivalent scores or decisions. So for example, if you were doing a licensing exam, you wouldn't want 1 year to pass students of one ability level and the next year to pass students of a much lower or a much higher level. So the idea would be that the test would produce, the assessment would produce equivalent results. Feasibility, obviously critical. The assessment is practical, it's realistic and sensible given the circumstances, has to be. Next element is educational effect. And we talked about this just a minute ago. The assessment motivates the students who take it to prepare in a fashion that has an educational benefit. Last two elements of the framework for individual assessments are that the assessment, if it's used for formative purposes, if it's used for teaching, has something called a catalytic effect. It provides results to students and the feedback to them in a way that enhances their learning. So the focus is more on learning and not so much on decision making. And finally, acceptability. The stakeholders in the process find it to be credible and reasonable. So they're the elements. And the other things that we came up with here that I think were important were the fact that the elements don't apply equally to all assessments. So for example, different purposes for a test lead you to value different of the elements. So for example, formative assessment stresses the educational and catalytic effect and the educational effect, more so than perhaps reproducibility or consistency. Likewise, different stakeholders value the elements differently. So for example, patients might favor the validity and reliability of summative assessments more than students or faculty members. So the idea is that these are the elements, you need to tailor them to particular situations. So at this point, we'll take you to 2018, and I'll turn it over to my good friend Brownie, who will take it from here.
Thank you, John, and thank you for continuing to operate the slideshow. So in 2018, the group reconsidered what it had done in 2010 and endorsed the framework that was created in 2010. So some of the things that I will be discussing are repeated from what John discussed occurred in 2010, but added a framework that focused on a system of assessment, so that we're talking about putting the elements together, not looking at individual assessments. And what this does is it really emphasizes the relationship and connection of assessment to the learning process. Next slide, please. So the elements of the framework for a system of assessment include coherence, which John has talked about, continuity, it has to be comprehensive, it has to be purpose-driven, acceptable, feasible, transparent, and free from bias. And I'll discuss briefly each one of these concepts. Next. So John has mentioned the importance of coherence. And for an individual exam, it was a body of evidence that hung together. And for the system, it's looking at these various pieces of a puzzle, if you will, various elements that contribute to a holistic view of assessment. And that as this says, there are multiple individual assessments and independent assessments that you use in the system. It is also continuous, so that everything that gets put into the system, all of the data that you collect all year long or all course long system, and within the context, it all makes sense. It's comprehensive. The system is inclusive, and that means that it includes formative as well as summative assessments, but they are designed in the context and for the purpose that they are most suited. Next slide. John talked about the feasibility, and this is clearly a critical component in individual assessments as well as a system of assessment, and perhaps more challenging when you're creating a system, because again, you have to make sure that it's continuous and comprehensive. And this adds another dimension to the feasibility, because you have to be certain that given the purpose of your assessment and who the stakeholders are and what the context is, that your system of assessment is feasible for everyone involved. John talked about the critical nature of the purpose of any assessment. And for a system of assessment, you have to be certain that it is designed to support the things that you want to assess, the purposes for which it was created. Acceptability, John has spoken about. The system has to be understood and found credible by everyone who is using it, faculty, students, the public. And two critical components of it are that it is transparent and free from bias to the degree possible, so that everyone involved understands how the system works, what the results mean, and that any unintended consequences. So you have to give careful thought to how you're designing the system so that certain examinees won't suffer in unintended ways from the exams that are contained in your system. Next slide, please. So there are advantages to what we called systems thinking, and it's one of the reasons that after looking at the work in 2010, we said, let's think about an assessment, a system of assessment when we regrouped in 2018. And so I think I'm going to start from the bottom of this slide, because I think one of the key components of this is that it optimizes possible solutions to problems. It gives you the opportunity to look at an array of assessments that can be used to address any problem that you are considering. It offers the possibility of analyzing the data and synthesizing the data in different ways, and encourages you to think holistically and broadly about assessment. And then it encourages feedback, which is so critical to the process of learning. John talked about the catalytic effect, and one of the things that the systems thinking really emphasizes is the focus on learning and how assessment has an impact on learning. Next slide, please. So John talked about the fact that no single set of criteria apply equally to all assessment systems, whether they are individual assessments or systems. It is key to consider the purposes and what you want to show as important, what you value, and what is less important. And to understand that because there are a broad array of stakeholders involved, that stakeholders may value the criteria that you're using for your assessments differently. And the system of assessment, as well as individual assessments, really recognize the need to connect and integrate teaching, feedback, and assessment. And with that, I will stop and thank John again for managing the slides, and look forward to the conversation. You're muted, Nuno. I think Beatrice is, there it is. Beatrice, Nuno needs to be allowed there to talk.
Yeah, I'm trying. I'm really trying. Oh, there you go.
Okay. Thank you, Beatrice. So thank you, Brownie. Thank you, John, for giving such a wonderful summary. In such a short period, you actually tackle so many different and important issues. So I will open now the discussion. I will ask people who want to ask questions to either write them in the chat, to raise their hands, or to speak if you prefer, even though I'm not sure whether you can be unmuted or not. And but I will start with a couple of questions. One first to John, and then another one to Brownie, and then I have an overall question to both of you. For you, John, I always struggle with names and classifications. So when you introduced in this summary the concept of system of assessment, or systems of assessment, in what dimension does that differ from the concept of programmatic assessment that we often read in literature?
That's really a great question, Nuno. Programmatic assessment, as I understand it, is a specific system of assessment. So it's multiple low stakes evaluations over time. There are a whole series of characteristics around it. A system, when we talked about a system of assessment, we recognized that there were several different kinds of systems of assessment. So for example, there's a system of assessment that may have several high stakes summative assessments that are part of it. There are systems of assessment for licensure, for example, or for registration. There are systems of assessment around admissions to schools. All of those have different characteristics. So English is an incredibly confusing language generally. Our goal was to think about systems as being a very broad category, with programmatic assessment being a special case or one system of assessment.
Thank you, John. Fantastic. And let me disappoint you. If you believe English is tough, I know you want to learn a bit of Portuguese. I can assure you that we are very, very, very creative in terms of language, as Brownie can tell you, because she now knows quite a lot about it. Brownie, so the next question is for you. And I really loved when I saw in the slides at a certain moment, you actually talked, you wrote formative, diagnostic, and summative assessment. And I really love this concept of formative, diagnostic, and summative. We are not used, I'm not used to the concept of diagnostic assessment. Can you elaborate a little bit more on this?
Sure, and I'm going to ask my colleague John to help with that because I didn't write all of these slides myself. I had help. And so I think it's important, first of all, to be sure that we recognize the critical nature of formative assessment so that it helps the learner understand. The diagnostic is if there is something, and this is how I understand it, and again, I asked John to step in here, but I've always understood that concept as something that is a step more critical, if I can use that word, than formative. It's recognizing here is a problem and a way to treat it, to use the medical analogy. And formative is let's hopefully learn from what we've done, both the good and the bad. Diagnostic to me has an element of this is a critical area that we need to capture and change now before things move on. Is that a fair analogy, John?
Yeah, I think it's an excellent analogy, Brownie. For what it's worth in the assessment literature more broadly, This has been bandied about for a number of years, and there are at least 4 or 5 different ways of categorizing types of assessment. And I'm an old man, and when I was a young man, diagnostic assessment was a hot thing. I think nowadays most folks are sort of saying diagnostic assessment is part of formative assessment. It doesn't really matter. The reality is the reality. You get to use these words however you want them. I think what's more important is the purpose. So I apologize for going back to the days when I was a young man.
No. Those are always very important messages and memories, John, on one end. And I loved what you said, Brownie, because I think it's very important. When I was thinking about it, I was seeing that this is probably a different perspective. In the formative, you are giving the learners the opportunity to actually get some feedback on their level of preparedness. Whereas in the diagnostic lens, it's most likely the faculty that inquires the community about a specific issue that will allow for intervention later on. And your analogy really caught my attention on this difference. So thanks a lot. So I have a couple of questions in the chat. Valdez has his hand up, and so I will read two of the questions in the chat, and then I will pass to Valdez. So one of the questions is, in your opinion, how important is the training of teaching staff in this area in terms of quality of degrees, whether considerations under the accreditation of existing degrees? So who wants to tackle this one?
Well, I'll start because I think that and to be sure I understand your question, Nuno, you're asking about the faculty understanding of assessment and the application of assessment.
Right. In a system of assessment, I think that there's an issue of governance of the system. And the general question here is, what are the skills, the competencies of those who govern the system?
Well, I'm going to let John answer that one, because I've changed it.
So that's an absolutely critical question. If you want to put together a reasonable system of assessment, it has to be centralized to a significant degree in order to make the exchanges, in order for everybody to be on the same page. So it requires a centralized assessment unit, for example, in a medical school. As far as the characteristics of the folks in that center, there need to be some content experts, there need to be some assessment experts. They need to work together closely with the faculty, and there needs to be a substantial faculty development effort. Because at the end of the day, the quality of the whole process comes down to the quality of the faculty, their understanding and their ability to execute.
Yeah, and I would emphasize John's last point, that it's the faculty and the staff in whatever centralized unit you have, they have to understand, but all of the faculty involved in assessing students have to understand the importance of the system, the components of it, so that the information can be passed along in a timely way, in an accurate way. We collect an enormous amount of data about our students and don't make good use of some of it. And so having that centralized unit where everyone understands is critical.
Absolutely. Thank you, Brownie. So Valdez, I will give the micro to you. I hope you can unmute. Beatriz, can you please unmute?
There
Okay,
he is.
there he is in the car driving. My God.
He's driving. Excellent.
Okay, Valdez, you are, oops, you are still unmuted. So Beatriz, can you please? Okay. Hello. Okay.
Can you hear me?
Yes, yes, yes.
Hello, I'm driving. I stopped here just to give my contribution in the diagnostic meaning, and I agree with Brown and John. I remember that I suggest this term. We used to have this in our discussions about assessment, and when we talk about summative and formative, we are talking about student. Diagnostic, sometimes people believe that it's a pre-test. It's not about that. It's the idea that when we do assessment, we have information about the program. It gives us information about the program. We use diagnostic or informative assessment. It's information that comes and tell us about how the program are reaching the goals. And this is an additional purpose when you are, especially when we are talking about systems of assessment. Just it's wonderful to listen, John and Brownie, and you. No, just it.
Thank you, Valdez. Abraços. Thank you for also clarifying that. Beautiful. Thanks. So, Brownie and John, I have another question here in the chat that I think it's really interesting. That is, so how would you suggest that I should convince my institution that it is very important to capacitate staff in this area?
Oh, that is a challenging question. And John is muted right now, and so it will take him a while to get unmuted. I think one of the ways, and I'm going to use a US example, but one of the ways that has happened in some places in the US has been the influence of the patients who are receiving the care of the graduates of whatever the program is, as well as the accreditation process, which looks at the outcomes of the students' assessments. And so if you don't have an accreditation process to use as a hammer to convince people that that's needed, having the public say that the product that this institution is producing is not the quality that we deserve can have an impact and influence the leadership to say, yes, we need to improve this. John is unmuted now. He can talk.
A mixed blessing. So I wish I knew how to do this, how to make people do what it is that they should be doing around assessment. It's completely impossible. It's also completely idiosyncratic. So it really is completely context driven. As Brownie said, if there's an accreditation process that forces this, that's great. I think there are some medical schools I'm familiar with where actually assessment and all of educational activities are part of a contract with the faculty members and therefore important. I think it needs to be recognized as part of the tenure and advancement process for faculty. So I think that there are lots of levers. Exactly which ones you use really depend on your context and what's most appropriate.
And I would add that one of the challenges, and it's something that John has certainly devoted his professional life to, and why he says he can't get anyone to do what he wants them to do with assessment, is that we often think of assessment separate from the educational program, so that we have people pass or they fail. And part of what the system approach is trying to reinforce is the idea that these are not separate. that the educational program and everything that is invested in creating and maintaining that educational program includes the assessment. And that's where I say we have all this data that we can use to make decisions, to change educational programs, to determine who graduates, who doesn't graduate. And so getting people to think about it as a complete system. We say system of assessment, but it's really the whole educational program, which includes assessment, is a key component.
Absolutely, Brownie. And I think that you touch a very important point, that is the quality element, both in terms of the educational process, but also in its standards. And I think this is very important. And of course, I foresee that in a near future, institutions do have to show this quality assurance process all over the world, and it would be actually pivotal for those institutions to have individuals in their faculty, in their staff, that can really be the curators of this quality assurance system on one hand. And on the other hand, I will pick something that was in your slides when you highlighted that the impact, the effect of changing assessment is much greater than changing the curriculum, even the processes, because it drives. People typically say that assessment drives learning. I think that assessment drives behavior, and by doing so, it actually impacts with a huge effect size on the educational process. So I think that this is a very important message, and it's a great way for us to close this wonderful webinar. I would love to thank Brownie and John for being with us, Valdesh for joining, and for also helping us in putting all these things going on. I would like to thank Beatrice for organizing everything, and also to create some stress to me by keeping me muted, and which is the best a moderator can be, is pretty quiet. And,
I'm sorry.
and thank you all for attending and for putting your questions in the chat. I hope that you have enjoyed this webinar as much as I did. And as I've promised you, we would start with a slight delay, but we will end on time. Thank you so much.